Did you know that staff and patient travel, just getting to and from hospitals,
Yeah.
can make up nearly 18% of all carbon emissions from healthcare activities?
18%. That's quite a chunk, isn't it? Really shows how climate change isn't just, an environmental thing.
Exactly. It's being called the biggest global health threat this century.
And it highlights this deep link between our health systems and, well, sustainability across the board. It's not just the procedures inside the hospital.
Right. The whole journey matters.
Mhm.
And that's exactly what we're going to dive into today. There's this innovative assessment framework for remote care, specifically in orthopedics.
Mm-hmm.
Our mission really is to unpack how hospitals can use this tool, boost their environmental sustainability, improve patient care, and cut their carbon footprint.
Yeah, and orthopedics is a really interesting area for this. We're seeing a big rise in interventions, largely due to, well, an aging population globally.
More demand.
Exactly. So this framework points to remote care as a key strategy. It helps manage that demand and cuts down on travel, which is great for sustainability.
Okay, so we understand the why, this pressing need for greener healthcare. Let's get into the how, this framework. How does it actually work? What does it measure?
Sure. So it's a pretty advanced tool, actually. It draws on best practices from hospitals internationally, and it's recommended by the Royal College of Surgeons of England. It focuses on 4 main areas for remote care pathways in orthopedic surgery.
4 areas. Okay, let's break those down.
First up is remote consultations, basically virtual visits, teleorthopedics.
Makes sense. What's second?
Second is incentives for staff travel options, so encouraging hospital staff to use greener ways to commute, bikes, public transport, that sort of thing.
Right, getting the staff involved. Third.
Third is involvement of surgical patients. This is about empowering patients, giving them education, digital tools, so they can manage some parts of their care from home.
Okay. And the last one.
And finally, minor surgical interventions. This means doing smaller procedures closer to where the patient lives, maybe in outpatient settings, instead of always needing a big hospital visit.
So you've got these 4 areas.
Mm-hmm.
How do hospitals actually use this? How does it give them, actionable steps?
Good question. The smart part is the scoring. Each area gets rated twice. Once for its current achievement level, how well the hospital is doing now on a scale of 1 to 5,
Okay.
and once for its importance to their sustainability goals, also 1 to 5. This gives a combined sustainability indicator score. It clearly shows where the biggest gaps and opportunities are.
A clear indicator. That sounds useful.
Uh-huh.
So was this tested anywhere? What did we learn from a real-world application?
Yes, it was validated at the Targu-Mures County Emergency Hospital, and the results were really interesting.
Oh, yeah? What stood out?
The area of incentives for staff travel options, that's I2, it had the lowest achievement score, just 2 out of 5.
Wow, okay.
But its importance score was high, 4 out of 5.
So low achievement, high importance. That sounds like a top priority.
Exactly. That flags it as the #1 area needing improvement. It tells the hospital, focus here for big gains. This means practical things like building secure bike racks, maybe setting up smart parking systems to reduce congestion and encourage people not to drive alone.
Right, concrete actions. What about the other end? Any areas doing well?
Yes, minor surgical interventions, I4, that scored really well. Highest achievement at 4 out of 5 and highest importance at 5 out of 5.
Ah, so they're already making good progress there.
Indicates they're likely doing more office-based or resident-run minor surgeries, which naturally cuts down patient travel and probably costs too.
So overall, how did this hospital fare? What was their sort of total score?
Overall, the hospital had about a 61.42% fulfillment degree for these remote care requirements, which is, pretty solid, but it also shows clear room for improvement.
And the framework gives them a way to track that improvement over time.
Precisely. It's a methodology for continuous improvement. And it's not just about being green, it links directly to efficiency, patient satisfaction, and hitting those broader sustainable development goals.
Of course, changes like these aren't always easy. What kind of roadblocks do hospitals typically run into?
Yeah, there are definitely challenges. Cost is often a big one initially, investing in the tech. Then there are technical hurdles, integrating new systems, and sometimes just resistance to change from staff or even patients who are used to the old ways.
That makes sense. Change is hard.
It is, but having a structured approach like this framework really helps navigate those challenges.
So recapping, we've seen how systematically looking at remote care, especially things like staff travel, can really move the needle on sustainability in orthopedics.
Absolutely. Pinpointing those key areas is crucial.
Which brings us to the final thought for you, our listener. What does all this mean for you? How could a data-driven approach like this, focusing on sustainability in healthcare, change the services you use, and maybe even impact the health of our planet? Something to think about.